Hello, everyone. This is Sadhana Alangar, HL7's Director of Education. Welcome to the Empowering People Transforming Healthcare HL7 Standards in Action webinar. Our speaker is Maria Moen, the co-chair of HL7 Patient Empowerment Work Group. At this time, Maria, I'm going to hand over the program to you.
Well, thank you for joining us today. We are excited to bring information to you during this webinar about the work that is occurring within HL7 to empower people, transform healthcare, and how standards can facilitate both of those priorities. We'll spend some time today talking about data exchange standards and how they are unlocking the value of healthcare information previously held in clinical record systems so that it is accessible across time and space. We'll look at how you, the individual who is moving through the healthcare ecosystem, receiving care, or perhaps you are an advocate for someone else, can be empowered through access to health information. We'll take a brief look at history to understand that the problem is not new and learn how we can shape the future of connecting people and their healthcare information. We'll focus on a few areas where you can make a difference, identify tools you can use to help bridge the gaps between providers and care settings, and why they can help you to be an active participant in your medical care. And we'll provide some links to resources you can explore within HL7 or Health Level 7 International, a member-driven nonprofit organization dedicated to creating and maintaining standards that bridge the gap in healthcare technology. Their goal is to improve the accessibility, speed, safety, security, quality, and cost of electronic health information exchange. First off, let's bring this home to the good people who have taken time to join this webinar. If there is one among you who can say no to these two questions, then we need to know what you are doing to solve a problem that has been around for decades or more. We'd love to hear from you seriously. We all do better when we work together. But if your answer to either of these questions is yes, then this webinar should be helpful as you learn about the importance of accessing your own health information and ways to bridge the gaps in the healthcare system so that you can be an active participant in your own healthcare. Let's dig a little deeper and look at why standards matter. Each time we go to the doctor, or have a test or procedure, or spend time in a healthcare setting, there are any of one of hundreds of clinical record systems that may be used by individual locations or health systems. Sure, there are about 20 that dominate the market, but there are many more that are in use, perhaps because they were designed to fit a specific specialty better than others. Think about your eye exam or dental visit. Those systems were designed to meet the specific needs of that kind of medical care. Then let's look beyond the need for specific kinds of medical information and how those care teams interact with you to appreciate that capturing your information and storing it differs greatly too. An X-ray image is captured differently than a lab test result is, which are both captured differently than a prescription for something at a pharmacy is. And all of that is recorded and stored differently than a doctor visit for a routine physical is. And certainly all of that is different than a hospital would record and store information about a health event that occurred, which necessitated an overnight stay or longer stay for a complicated situation. You are a total compilation of everything you've experienced, been through, and are going through right now. Doctors, nurses, and care teams need all the information they can access to provide the very best care that is based on you, personalized to your needs, history, and preferences for your life. To reach that comprehensive picture of who you are as a human, an individual, we need a common way of communicating information between providers and their EHRs. So we have bits and pieces of your health information scattered across different electronic health records, or EHRs. And while we understand how this occurred, We need to understand how to stitch all of the various pieces together into a single comprehensive record that tells a more complete story of your healthcare journey. How can we expect a new provider, or even one we've seen for some time, but that we need to see again and understand what has transpired since last we saw them? How can we help them provide the right care and treatment if they only have part of the picture? There are lessons to be learned from other industries. We can use our debit card across the US and around the world to access funds from our bank account. That didn't exist when debit cards were introduced, but today it is expected that we have this ability. We can also look further back in history at another example because we can learn from another industry that had struggles with connecting. They too had to create standards to connect. And once the industry knew there wasn't an option, it had to be done. The connections brought the US into a period of rapid growth, expansion, and significant advantage around the world. We're going to take a quick trip back in time to the late 1800s and how the railway system in the US evolved. You'll be surprised at the similarities of the problems that existed, the various solutions that were brought forward, and how standardization became the only option of connecting people across the US. As I review these points, think about your distributed health information, how different railway companies work to address the need to provide a single track width to move from coast to coast, and how in the end there was no other viable solution than standardization to achieve the kind of transformation in our railway system that brought our country into the industrial age as a leading world power. And so you look at some of the facts that I've provided here. The Camden and Amboy Railroad, they choose a 4-foot 9 3/4 inch gauge. And then in the South, they built a 5-foot gauge. And then nearby states wanted to interact with those railways, so they copied the gauge. And by 1861, over 7,000 miles of track with this wider gauge had been laid throughout the South. And then the Ohio legislature established a 4-foot 10-inch gauge, and then California chose a 5-foot, and some of the railways in Missouri and Texas chose a 6-foot, and then Canada chose a 5-foot 6-inch gauge as a military strategy, right? So the limitation was intentional. American trains couldn't operate on Canadian rails. And as these railways proliferated and travel expanded in the mid 1800s, the breaks in the gauge presented continual problems. Economic and political factors influenced the adoption of a standard gauge for railways. Growth and the need to move across the country became a more pressing problem to solve. It became a national crisis. And various solutions were tried, but they all had points of failure. Charles Tisdale had a great idea, but that design was prone to careless handling and wear, and it caused many accidents. And then there was another solution, carry the narrower gauge truck cars over the broad gauge roads, and then you had to hoist them. But this made the car top heavy and it's unstable, and it only worked one way. The broader gauge cars couldn't sit atop the trucks on the narrower rails. And then John patented a steam-powered lifter manufactured, but though those systems could refit 8 to 10 cars per hour, it was a really slow and expensive process. Sometimes the problem was attacked at the track level, and some companies laid a third rail or they laid it outside existing rails. And as the markets widened and the railroads began to move products outside of their local networks, it became clear that the only reasonable solution was to standardize the rail gauges. Solutions to stitch the nation's railway system together had been tried, and none were scalable or without known risk. Time had moved on, and the people needed to move, as well as their goods, farther and farther distances. And the solution was obvious, but it sure wouldn't be easy. Through a massive effort, carried in part by legislation to ensure there was a common solution for all to utilize, the track gauge across the U.S. was transformed into a single standard. In 1863, the U.S. Congress passed the Pacific Railroad Act, which mandated the use of a standard gauge for all new railroads constructed in the country. Now, changing the rails was an expensive process, both in actual labor costs, with some companies hiring thousands of workers to change all their rail lines at once, and the loss of revenue down to that railroad downtime was mounting. But once the decision was made, change came quickly. For example, Illinois Central hired 3,000 men to change out their southern line to the standard gauge and changed all 547 miles of track in one day. And the Louisville and Nashville, the L&N, hired 8,000 men to change their 2,000 miles of track to the standard gauge, also in one day. And by the end of the 19th century, standardization was implemented, and the dawn of the industrial age was upon the U.S. The parallel is pretty apparent, don't you think? But let's just take a closer look. On the left is the railway. On the right is health information. So let's start on the left. Reduce costs. A standard gauge reduced the costs associated with all of the production of the rolling stock, the maintenance, the expenses. By standardizing the gauge, railways could order equipment and parts in bulk, which reduced costs significantly. Also, for the railroad, increased efficiency. That standard gauge system improved the efficiency of transportation by allowing trains to travel more quickly and safely. So, standardization of the gauge also ensured that trains could travel across different regions without the need for complex switching systems and all types of delays. And then improved safety. That standard system improves safety by reducing the risk of derailment and other accidents. By standardizing the gauge, railways could ensure that the wheels of the trains fit the tracks properly, reducing the risk of derailment. Now, let's look to the right for healthcare information. Reduce cost. Those data standards can reduce costs by minimizing data redundancy, streamlining data processing, and improving data quality while enabling efficient data sharing across different systems. There is more health information available and needed today than ever before. But having multiple instances of components within your health information creates continual problems, like railways. And then bullet number 2, when we're looking at increased efficiency, standardized data enables smooth data exchange between different systems, reducing the need for, complex data transformation. People expect effective, personalized care that is informed by what is known about them. And then safety. With standardized data formats and validation rules, errors and inconsistencies are minimized, and it reduces manual intervention and the need for manual data cleaning and correction. Rising healthcare costs due to redundant tests or unwanted procedures as a result of inaccessible health information, that affects us all, either directly or indirectly. So the healthcare system in the US and really around the world is undergoing what you could call a Copernican shift, where the EHR and the data it stores made the provider the center of your healthcare at that location. The connection of distributed healthcare information into a single comprehensive view of your healthcare journey puts you, the individual, in the center of their own healthcare. Excuse me. There is an incredible amount of work going on within HL7 to create and improve the data standards used to access and exchange healthcare information. Too much, honestly, to list here, but that's a webinar of its very own. So in order for us to keep our focus, I extracted a few elements that will help us look at empowerment of the individual and how these efforts are instrumental to transforming the healthcare system. Smart on FHIR will take a little journey through that. Patient portals. And while the portals themselves are not directly the work product of HL7, I hoped to bring some information to light that would create a link between them and the healthcare data standards. We'll talk about fast consent, and we'll talk about the standardization of health information for access and use. And there are so many more projects and groups working on empowering people through their work. These are but a few, but I think that they will be insightful and give all of you a flavor. Excuse me. The Smart on FHIR application standard. Smart on FHIR, excuse me, is a data standard that enables applications to securely access information in an electronic health record system so that app developer can write one app and it connects to any EHR system that has also adopted the standard. Think about your Apple App Store, right, on your phone, or Google Play as a parallel. The application being connected has to be registered. That way you see the little image, and it usually exists in a list. This is what the Smart on FHIR app standard supports. Now, the apps available to the user then provide a reliable, secure authorization protocol, and it can be used by clinicians, it can be used by you, patients, and others via a patient portal or a personal health record or any other FHIR system where a user can launch an app to accomplish a task. And why is this helpful? You want to visualize something, you want to look at data collection, you want to look at clinical decision support. When my EHR receives this piece of information, it acts as a catalyst to do something. You want to look at data sharing, you want to look at case reporting, you want to look at a smart health card, and so many other functions. Patients are able to securely access their health information from the application and device of their choosing as they access different providers and EHR systems. Now, we're going to spend a minute to talk about patient portals, and we'll look at the pros and we'll look at the cons. So, we know that patient portals have revolutionized how healthcare teams interact with patients to create a dynamic and open partnership. And at a time when patients expect effortless communication and accessible up-to-date information, patient portals provide a central location on which to build this relationship. Oop, sorry, happy fingers. Patient portals also provide a variety of self-service tools, which, if used optimally, can empower patients and transform their role from recipient of healthcare to partner in healthcare. They can also help fill out intake questionnaires or health surveys that can be pulled directly into the chart in the visit note. Remember, this whole patient portal really provides a forum for communication. You can look at, you can pull in lab x-rays, labs, x-rays, medications prescribed, maybe versus those taken, cultural and spiritual preferences for care, procedures you've had in other locations, updates to past medical history and family history. And all of that can provide context about you and your care. You could enter a chief complaint and a history of a present illness, which could be pulled directly into the visit note. You can enter remote patient monitoring. Maybe you've got a home blood pressure monitor. You can attach photos, fillable forms, advanced healthcare directives, or other documents for the care team to review. With technological advancements and the widespread adoption of telehealth, patient portals have greater potential to engage patients and reduce care team burden. Now, let's look at the cons. We know many people do not like using their patient portal to access their health information. They've already got too many logons and passwords to remember. This just feels like another. And I, as an individual, I see different doctors. I see different providers for different problems. And I don't have just one portal that contains all the information. I've got a bunch. But think about it this way. They are a vehicle to accessing your own health information, just like debit cards are a vehicle to accessing the funds in your bank account. If you have more than one bank account, you probably have more than one debit card. So if you see more than one provider, you're probably going to have more than one patient portal. And the increasing use of portals and expectations around being able to contact your care team for asynchronous communication has really created a challenge for physicians' work-life integration, and it is contributing to professional burnout. Many physicians feel like they are drowning in the volume of patient portal messages. They're spending every minute between patients during clinic, as well as evenings and weekends, doing the additional, typically uncompensated work of catching up and responding to messages. And the initial patient portal model has become neither sustainable for physicians nor beneficial for patient care. So another aspect of patient portals, they support regulation to empower us as patients, as individuals. The 21st Century Cures Act was released, and the 21st Century Cures Act requires healthcare organizations to have the capability to release electronic health information to patients as soon as the information is finalized. The Act includes a provision requiring that patients be able to electronically access all of their health information, structured or unstructured, at no cost, and outlines penalties for noncompliance or information blocking. The HTI-1 final rule, that was HTI, Health Data Technology and Interoperability. So it provided certification program updates, algorithm transparency, and information sharing guidance. And it required standardized application programming interfaces, APIs. Again, think about your Apple App Store, and you've got an icon there for a platform that you want to access. When you click on the button and you sign on one time, and then they know who you are, that is an API. So that included adoption of the Smart App Launch Implementation Guide version 2 after the end of 2025. New functionality that enables an internet-based method for a patient to request a restriction on the use and disclosure of their electronic health information was also included in HTI-1. Looking at HTI-2, which were specific requirements for health information technology that could be used by payers to allow patients to access all kinds of health and administrative information using a health application of their choice. Maybe the patient's access to drug formulary, clinical, coverage, claims information, all of that would be included. So again, talking about patient portals, why? Why do I need why do I need access to my health information? Here's what you may need to understand. Starting 12/31/23, last year, people have the right to request and download a comprehensive digital copy of their health information. Maybe you want to share the information from one health system or EHR with a clinician you are seeking a second opinion from. Maybe you want to run your health information through AI to understand it better, to demystify it, and help you decide what you want to do as a next step. Maybe you want to donate your health information for research and innovation in medical practice. Or maybe you want to contribute your own health tracking or important information, like your advanced healthcare directives, to all of the available information to provide context or fill in the blanks between visits. Now, we're going to talk about fast consent, and I'm going to provide some quick facts. So, healthcare's digital transformation is accelerating and data fluidity is improving. But the need, excuse me, to ensure that patients maintain control over their own health data is becoming more urgent. The key question is, how do we efficiently manage patient consent to ensure privacy preferences are respected at scale across multiple organizations and systems? First off, what is FAST? In healthcare, we love our acronym. It stands for the FHIR at Scale Task Force. And what is the goal of this project? Well, consent management is a very complex issue, and being able to manage and transmit consent records at scale is a project in and of itself. This project emerged in response to these challenges, and they are focused on how to make consent management effective across a very diverse and multifaceted ecosystem. Project leads are spearheading efforts to define scalable consent handling strategies that align with both technical and legal requirements. And what are the key use cases? Well, you look at the emphasis on pre-populating forms while also ensuring consistent identity management. What's identity management? That's making sure that you are authorized to consent for the person in question. And maybe the person in question is you. So looking at fast consent, great. Now that I understand it, how does it empower me? Well, as stated, when healthcare data becomes more fluid and more interoperable, a person's privacy preferences are more vulnerable to falling through the cracks. Health IT vendors, health plans, providers, and other key players need efficient systems to manage the complexities of consent in a compliant and scalable way. And without agreed upon standards and approaches, healthcare organizations risk failing to honor patients' wishes, undermining trust in the system, and possibly facing regulatory backlash. Consent management is no longer just a legal requirement. It is a linchpin for trust and security in an increasingly interconnected healthcare ecosystem. So let's look at a couple of terms. What's the difference between opt-in and opt-out when consenting to share healthcare information? Opt-in empowers individuals regarding sharing of their health information. This shift in control builds trust and fosters a sense of agency in a landscape where privacy concerns are paramount. So then what is opt-out? Well, that's your indication that you don't want your health information shared. Further, if it has already been shared with others who are treating you, they shouldn't do so in the future. And it is often perceived as a simpler and more convenient option for individuals. Now, let's look at another topic, standardization of health information for data access. We just heard the story about railways, so we know that standardization of health information involves establishing common languages and coding systems to ensure that healthcare information is uniform, shareable, and easily understood across various platforms and healthcare organizations. Here's a scenario you can consider, but maybe you can put yourself into. So imagine a scenario where the patient presents in an emergency room and they have a complex medical history. Over the years, this person has visited multiple healthcare facilities and had multiple providers provide treatment to them, and each one has its own set of codes and terminologies. As the attending clinician, your ability to make informed clinical decisions and provide the best care relies heavily on a comprehensive understanding of the person's medical history. This means having standardized, easy to interpret data. All too often, though, the information about this patient's medical history may be fragmented, incomplete, misspelled, or unintelligible because healthcare data and codes aren't standard. But let's look at the challenges. So, what are some of the challenges that we can face? Data inaccuracy. A simple code variation or an outdated code could cause misinterpretation and lead to potential patient harm. And data fragmentation. We've got healthcare systems and data exchanges. If they don't communicate effectively and have code discrepancies in their communication, patient information becomes scattered across various databases. And it's very difficult for clinicians to access a comprehensive view. It's definitely provides reduced efficiency. That added administrative burden overloads the clinician. It reduces their efficiency, and it can be detrimental to the quality of care delivered. And then the paramount element within good healthcare are your safety concerns. Misinterpretation of a non-standard code or inaccurate or incomplete medical data can simply lead someone to an incorrect diagnosis. They didn't have the facts they needed. Maybe inappropriate treatments, maybe delays in treatment because they're trying to get their hands on what they need. And overall, this compromises patient safety. These concerns are crucial in an industry where precision can mean life or death. And then, of course, limited research opportunities. With inconsistent coding, this limits the researcher's ability to progress clinical studies and treatment development. So, what are the motivating factors for standardizing health information? Improved interoperability. When it's standardized, it is easier to exchange information between different healthcare entities, and it ensures that patient data moves seamlessly across the care continuum. You get enhanced data accuracy. Standard terminologies reduce the likelihood of coding errors, ensuring that medical data is accurate and consistent. It provides a streamlined workflow. Clinicians can devote more time to patient care because they don't have to decipher inconsistent or complex coding systems. And we know that that creates better patient outcomes. When the information is complete and standardized, clinicians are liberated to make well-informed decisions, resulting in more effective treatment and improved patient outcomes. And then data analytics and research. Standardized data is crucial for health and analytics. Epidemiological studies, that was a good Scrabble word, and clinical research, enabling the discovery of insights that can improve and save lives. So we know without data standards in place, sharing that data with other providers and organizations can get tricky. It can be stored in formats that are incompatible with another provider's systems, or maybe they use a different database that the other provider doesn't have access to. Well, gee, that seems pretty logical. Why is this so hard? To achieve true interoperability and seamless data exchange, as an industry, we must address resistance to change. Healthcare systems and providers may resist adopting new standards due to the cost and effort required for system updates and staff retrainings. I am very sure that the railroads did everything in their power to avoid having to rip up and lay new track. Then we've got legacy systems. Many healthcare organizations operate with legacy systems that have been in place and a part of the lifeblood of that health system for a very long time. But they need more flexibility to adopt new standards, and that makes it very hard to transition to a standardized environment. There are also regulatory hurdles. Regulatory bodies and government agencies must play a role in mandating, regulating, and incentivizing the adoption of standardized coding systems to ensure industry-wide compliance. Remember the Railway Act? And then global considerations. International standardization is essential. Medical data is often shared between countries, and coordination at a worldwide level is required to harmonize standards across borders. Together, we can transform healthcare. Empowering patients is giving them, you, control over healthcare in ways that clinicians may not typically consider. And patients, we want ownership over the things that matter most to us, such as measuring and monitoring our own biometrics and having access to condition-specific information when and where we want it. And empowering patients means giving us data and the technology and the education to process it so that we can more effectively use or reduce the time spent on other activities that directly affect our health. We want you to partner with HL7 to ensure that your voice helps to shape the future of healthcare. Access your information, see what exists so that you can make it available to others when EHRs don't share information. Understand what health information exists on you so that you can be more educated about what other providers will learn about you when you need healthcare services. And identify ways to store and work with the health information you have access to so that you become a full partner in your care. Learn what you can do and who you can talk to for guidance if you don't have access to your health information. You can access the projects and the work in process at hl7.org for free. Get involved to help transform the transition to a healthcare delivery system that puts you in the center. And trust me when I tell you, you don't have to be a trained clinician or a computer program developer to join and make a difference. I want to thank you for your time, and I'm going to move to the question and answer session. We appreciate you making us a part of your day and hope that the information shared was helpful and meaningful to you. You can play an active role in transforming healthcare, and we would love to have you join us. Go to hl7.org to create a free account. Log in and explore where you can help. And as always, if you need assistance, you can reach out to HQ at hl7.org and they will be happy to help you. So let me stop sharing, and I will go ahead and put my camera on. There we go. And so let me take a look at some of the questions that have come in via chat. All right. So what are the typical challenges faced during the implementation of HL7 standards, and how can they be overcome? There are a number of typical challenges that are faced, and there are hundreds and hundreds of people in organizations that have put their shoulder to the boulder to really begin to move us to a more standardized healthcare data ecosystem with personalized care. So, how can they be overcome? By getting involved. Sometimes it is an educated consumer that is able to, from a grassroots level, push change up through an organization. If you become aware as an individual of what your rights are, I should be able to access my own health information. Then when you go to the doctor, if you are not able to do so easily, educate them. Become an active participant, because then that doctor will contact his electronic health record system, who is probably already participating in HL7 and wants their customers need something from them. Every vendor out there will respond to that need. So be aware of what you should be able to do and help educate your providers. If you can't do it, that creates that down, that lower pressure and pushes it up. From the upper levels, please get involved in HL7. We have a ton of passionate, really just self-sacrificing clinicians who spend hundreds and thousands of hours every year trying to inform standards. But we need your voice, because you have a PhD in you. And so they need to hear from you what you need to see to counterbalance what they know that they need to see. What team structure works best for FHIR implementation projects? In my experience with the projects that I have run with, the team structure that has a technical architect, someone who can take all of these human words and these thoughts and these scenarios and these situations and really translate them into technical language that systems can program from. So you need a technical person, you need a subject matter expert in that area, and maybe you need a couple. So maybe you need a nurse, and maybe you need a doctor, and maybe you need a radiologist because that's the kind of standard you're working on, or you need a lab technician, or you need a bunch of pharmacists. You need subject matter experts. And it is my opinion that we need patients, plain old-fashioned people like you and me, to get into every single project and to weigh in. And when you don't understand, you ask them. I am famous for lowering the bar. And I will walk into a highly technical project and say, I'm sorry, I really don't understand what you're talking about. I need some context. There is not a group in many, many years of working with HL7 that doesn't stop and help you understand what they're doing and how you can contribute. They welcome your presence. So to me, that's the ideal structure: technical, subject matter experts, and then the community of people that advises them. When you have a limited budget available, what are two recommendations? So looking at, and I don't know anybody that has a massive budget available at this point in time, so that could be an everybody question. The best way to accomplish an HL7 project is to find what it is that you're looking for, look at your existing business relationships, and maybe partner together. I know within my organization, we have a number of partners who do a lot of different things to integrate into the ecosystem of healthcare. And when I have a partner and then I can align with them and even align with a couple of partners, all of a sudden the costs of having a test bed and doing all of this testing and making sure that you can do what you need to do, these costs are greatly reduced. When all of us come together, um, we can we can reduce the individual costs while magnifying all of the individual gains. Any statistics on provider compliance? I do not know the answer to that question. Sadhana, if you and Melissa will help me with a takeaway, we will see what we can do to find some statistics together, and see if we can respond to this question from Daniel. So Daniel, that's a great question, and a truly useful patient portal. Electronic health records specialize in the various areas of medicine that they serve. And patient portals are very often a piece of that electronic health record. And so you're going to have some that are very focused on, let me just give you the clinical data that you need, right? And others that are very focused on, ooh, would you like to set your own appointments? Would you like to pay your bill? Would you like to, have an interactive chat with a clinician? They they all have a different focus. That's the beauty of the US, that all of them are looking to solve different problems. And I think if you look at some of the changes that are coming, thanks to 21st century cures, thanks to HTI1, thanks to HTI2, and thanks to this massive tsunami of dedication and passion on the part of these clinical system vendors, you are going to start to see some massive changes. So now is the time for you to get into HL7 and give them that patient perspective. I think that you are going to start to see more and more capabilities and more useful patient portals. What is the most relevant healthcare waste you may improve through interoperable medical devices? I think that the last statistic that I saw, and I believe the statistic was dated 2022. So it's a year or two old, but healthcare moves slowly. I think it works. $2.1 billion was spent on unneeded, unwanted, unnecessary overtreatment. So when you look at the fact that without information being accessible to the providers who are so well skilled at looking at all of these clues and all of these facts and really working with you to derive the right treatment pathway, then you know that standards need to occur. And so that waste is really a problem. When you look at interoperable medical devices, if I have a primary care physician and he has sent me to a cardiologist and I have a home heart monitor, that device, that medical device should be able to communicate using standards to my primary care physician, to my cardiologist, to my oncologist, to my physical therapist, because guess what? I have to do some PT and he doesn't want me to have a cardiac event on the treadmill. So how can medical devices help? Through looking at interoperable data exchange, using Smart on FHIR apps that allow everybody to take a look at the data. I thought that that would be a helpful question, and I hope that these answers are helpful to you. Is there a way to retrieve normalized medical information directly from the HIE networks? I stay very close to TEFCA and the work that is going on to build these massive health information networks that are really going to help interconnect all of the health data across the US. And Sadhan, if I could impose on you, bring this question as a takeaway. There are some very specific requirements and items on the roadmap that are about people being able to sign into a health information exchange and see their own information and even access that information. But that's a short answer to a very deep question. So allow me to circle back afterwards if you would be so kind. Okay, let's see. Any HL7 specialized training programs? Yes, there is so much education like this webinar. There are so much coming out from HL7. There are opportunities to learn about standards. There are opportunities to learn about a particular work group and how you can inform that work group. So looking at training programs, Sadhana, I'm gonna batten that tennis ball over to your side of the fence for a follow-up. The training is extensive that is available through HL7, and you can learn about sessions just like this, which are just built for normal people. And why should I even care about all these standards? Hopefully now you know. But there are also trainings for experienced developers, for lab technicians, for X-ray technicians. So please avail yourself of the training and education that exists. Let me see. I don't think I see any more questions in the chat, and I hope that this has been helpful. I hope it's been a good use of your time, and I hope that it built a hunger in you to really get involved with HL7. If you're already involved, go learn what some other groups are doing. If you're not involved, it's a free sign-on. You can see what the groups are, what the projects are, reach out to a few people, find out what they think you would be the most impactful to um, really get involved with. What are you most interested in? What are your problems? And then get on those calls. Just get on a weekly call. I promise you, you will be welcome. And if you need a little hand holding to get through some of the technicalese, and maybe you don't, but if you need some help, all of those work groups really want the voice of the patient. I am the patient empowerment co-chair. There are 4 other individuals who help me co-chair the patient empowerment work group. And we can't even keep track of all the projects we're asked to be involved with. They are constantly reaching out to us. Hey, we're doing this standardizing how treatment plans move from one system to another system. We'd really like to know from patients, have we thought of everything? Have we made things too restrictive, too loose? I mean, they really want your feedback. They want to be informed by what you, the individual, needs to see in your home healthcare information. Maybe you're bumping your head against something out there in the healthcare ecosystem, and you want to come in and go, hey, I need you to remove this brick wall. Help me figure out how to do that. They will educate you. You can educate them. And we have yet to find a group that didn't look at patient empowerment's involvement and say, thank you. All of them are so glad that we're there. And they take it down to my level where I can understand what the problem is when they're looking for solutions. So please get involved. Let's see. And we see that one. We see so much traction nowadays about adopting the FHIR standard for prior authorization implementation. Prior authorization is one of our track not connecting problems, to use a railroad metaphor. When you look, I've spent a lot of time in long-term post-acute care, and in a single building, we can deal with 40, 50 Medicare Advantage plans. And when each one of them has their own way of doing prior authorization, right? So these services are okay, but you better prior authorize this one, or none of these are okay. Oh, and you better prior authorize it 48 hours in advance. And there's all of these different plans that have all of these different rules. So when you look at a FHIR standard for prior authorization, this helps the provider because it's a standard and it is adopted by all of these different payers who are trying to do the best they can to offer as much coverage as they can while sort of fighting fraud and abuse. And so that prior authorization standard is going to be very impactful in a number of settings. And ASTP, I'll always call them the ONC, the Office of the National Coordinator that creates technical regulations, they have shortened the timeframes that are required from payers to respond. I mean, they're really doubling down on empowering people to get the care they need, understanding administrative hurdles, fraud and abuse, and that sometimes there are bad actors out there, as much as we wish that there weren't, but they are working very hard to take elements like prior authorization, smart apps, fast consent, and they're trying to make the healthcare system more tenable, more responsive, more personalized. So I think the prior authorization, standardization is going to be huge for patients who need care and really just care differently about prior authorization and administrative hoops. Let me see. There's some other great comments in there. Oh, you guys should really just give this presentation. Mandate, yes. Oh my goodness, yes, Melissa. All of the payers would like to be would like to have the involvement of patients. There are payer-initiated projects within HL7, and all the payers are like, oh, I need to conform to prior authorization. Okay, well, let me get involved in a group and I'll see what I need to do to reshape my process to achieve the standard one. I'm just picking on prior authorization. It's certainly not the only thing they're working on. But having a patient get in there and offer your voice, hey, I hear what you guys are doing, but here's the deal. Here's what happened to me, and I hear your solution, but it still wouldn't have mitigated this problem. That is an insight that is so valuable to them, and they will look to be informed by your scenario that is real and happened, and they'll look at solutions. So please get involved with your payers. They're not the bad guys. These payers are out there just trying to provide cost-efficient, equitable, comprehensive healthcare. Yeah, thank you, Jeff. I hope I spoke accurately for Da Vinci. Let me see. I don't think I see anything else that I need to respond to. We are 5 minutes before the top of the hour. I'm really grateful that you guys came. I really hope that you get involved in HL7. Don't let us sit out here and create standards with the small army of patients that we have that are informing standards across the US that are going to change the face of healthcare and how medical care is delivered. Don't let this continue without your voice. Please come help us. It doesn't cost you a thing except for a little time, and I guarantee you will walk away more empowered and more able to be a partner in your care than you were before you joined. So, Sadhana and Melissa, I'll turn it back over to
Yeah.
you.
Thank you so much, Maria. I just wanted to share a private message that I received from a member. The content is very strong and has the foundation for building great value stories to provider and payer makers to engage in our interop marathon here. Excellent presentation, Maria. Thank you so much. Thanks everyone for joining us. Till we meet again. Bye everyone. This is Sadhana Alangar. Happy holidays.
Yeah.